You're listening to the Public Health Epidemiology Careers Podcast, Episode 34.
Welcome to the Public Health Epidemiology Careers Podcast, where we explore public health epidemiology careers and share tips and strategies to help you enter or transition into the field. And now, your host, Dr. Charlotte Hughes-Huntley.
Greetings, everyone. Thank you for joining me on this episode today. To all the people who are recently finding the podcast and just tuning in, or maybe it's the first time, I really appreciate you being here. And there are some of you who never miss an episode, and I really appreciate you as well. Just wanted to emphasize that and just say thank you from the very beginning here. I just wanted to make sure that you all know that I appreciate you very much. It means everything. I put this podcast together week after week, putting together topics that are usually a result of questions or comments that I've been receiving, and it's a way to share it back with the vast majority of you. So today I am going to be sort of summarizing my experiences over the last 3 months with the 1 Billion Steps Challenge. Now, it's not just going to be about the steps, but it really is about my experience with this health promotion campaign, what I learned, and I think by sharing some of this, it's going to help a lot of you as well. So just to back up a little bit, the American Public Health Association, if you remember in last week's episode, I talked about National Public Health Week. And if you didn't listen to that, it's not required before going into this one, but they do sort of go together. So it'd be great for you to go back and make sure you listen to last week's episode, just episode 33. But so last week was National Public Health Week, and the end of that week marked the end of the 1 Billion Steps Challenge. So the APHA started the 1 Billion Steps Challenge on January 1st. And it was to go through Public Health Week, and the last day of the challenge was April the 8th. So that's 98 days. And let's just go back a little bit, because some of you who listen regularly will remember me bringing this up at the beginning, and I mentioned it a few times throughout, and then the weekly updates that I email, I would give you progress reports at the bottom of how the team was doing. And some of you were on the team with me, which I really appreciate as well. So they have this, apparently this is happening every year, but this is really the first year I paid attention to it. And I was going through a little personal struggle at the end of last year. When I mean by struggle, it was just, I was trying to decide just how I wanted to do things a little differently, because I walk regularly. That is, for those of you who know me, that is really my exercise of choice, and for a lot of reasons, but I love to walk. And regularly, that's what I do. I get up very early. It's a part of my routine first thing in the morning. And I do that, I would say a good 6 days out of the week, on average. That's really where I fall with that. And I love it. I listen to podcasts, not my own, but I listen to other podcasts during that time. And I just use it as a personal, professional development hour. So I spend a good amount of time with that. So it's something that I've done really faithfully, and I've used it to help manage my own chronic conditions. And it's just something that has been a part of my regimen. It helps me, and I'm really disciplined, and I monitor my numbers, and I track my progression, and I know how well I'm doing, and I have good discussions with my physician when I go in for checkups. And it's just something that I have done for a long time, and I will. I compare to my own numbers. So I'm not trying to mark or imitate what someone else is doing, or, try to reach a certain weight because someone else is a certain weight. But I really try to maintain a healthy weight for myself that helps my other conditions, be the best managed. So I do all of these things, practicing what we teach in public health. And toward the end of last year, I was really thinking about how I can be a more visible example. I wanted to demonstrate more of what I was doing in a way that other people could benefit from. I wanted to be that example, in the midst so that someone else could watch what I was doing or not just hear me talk about how important it is to eat well or how important it is to exercise regularly, but to actually see me doing it. And maybe that would raise a question. And I wanted to spark conversation among other people who may struggle with other conditions and they want to get started in some sort of activity. And maybe I could just inspire them through my actions. And, either whether it sparks a conversation or not, I just really wanted to become a more visible example. And when the challenge came around, I knew I was going to participate in the walk challenge, but I didn't know what team I would join because I am not really connected with other groups that were participating. I didn't know of a specific team that I wanted to be a part of. And I could have just joined another team. But by this time, my community was growing pretty well. So the podcast had been going for quite a while and I had quite a few listeners and I had a lot of conversations with many of you and we were just doing really well. So I had the idea that I would lead a group. I would start a team and just open it up for anybody who wanted to participate. And it would really, my goal going in, of course, being a visible example, because by doing this challenge, it would give me a way to sort of talk about what I was doing on a regular basis, just, put that out there so people would know and just have it be an easy way to open up conversations. And really and truly, I was happy to just have a handful of people, even one other person, but, a couple of people that were going to do this with me so that I wouldn't be a team of just one. That was really what I was going for. I was hoping for just a team of more than just myself. And it wasn't that it would hinder me. I just wanted to have more fun. I thought it would be a great way to bond with somebody else who cared about walking or who was really motivated to do it. And I would not have to just be the team of one for a change. So I went into those expectations. That was about as high as it got right there. And so I did a live video. I did it on Periscope, actually, on Christmas Eve. And then that week between Christmas and New Year's, I talked it up and I had really made a firm decision I was going to do this. I had a post on my page. I talked to you guys about it. And I was just, I was determined. I was ready. And there was a lot of interaction on that live that I did. And I didn't really go back and do much more on Periscope lives, but I just kind of kept it going. Well, the team, real creative here, DrCHHuntley and Friends. I didn't try to come up with anything fancy. But I put it all together and I got real excited about it. So I started, on the first day tracking it, and I would just simply do a screenshot of the app not every single day, but every few days, just to keep a journal of what was going on. That screenshot gave me, my team's standing and in just that basic top line information each time I would take the snapshot. And, I noticed really quickly that, like the first week or so, we were, really toward the top of this leaderboard, which I didn't even think would be there. This leaderboard tracked the progress of all the teams, so you knew where you ranked at any given point. So that didn't really show up until after the challenge started. So I was really happy to see that. And I started, like I said, checking those screenshots to see where the team was, and we started to gravitate toward the top. And I didn't really think there was that much to it. I thought, well, there's only it's like at this point, maybe, 150 or so teams. People were just still adding in, and I figured it was going to settle out. But we just kept going. And you guys know, in the wintertime, January 1st, on the one hand, everybody's excited because we're making New Year's resolutions and, it's kind of like we're getting past the holidays. Everybody's on to a good start for the new year. So it's a great time to recruit people onto something like this. But at the same time, it's still cold outside. It's dark. It's gloomy. A lot of, depending on where you live, you got snow everywhere. And, snow is not really an issue here for me, but it's still cold and dark when I get up very early in the morning to take my walk. So I had already decided I was committed to doing my morning walk because I knew that was the only time of day that it would fit my routine. So I just would layer up. I was out there every morning. My neighbors got used to me being that neighbor that does that routine, that early morning walk. And I just kept snapping, doing the screenshots. I kept getting out there. The people within the team were just so motivated from the very beginning and very interactive. And that I was feeding off of that. It didn't take much for me to feel encouraged. So just anytime, I was committed to posting little messages in the group, but there were times that others would get to it before I got to it. And I loved it. It just felt really good. This team of people from all around the United States, and there were some from different countries, but for the most part, we're all in the United States, different parts of the country. We never physically walked together as a team. We didn't geographically live close enough to where we would physically walk together, but we kept up with each other's progress and steps. And it was a very exciting experience. So about, I don't know, a few weeks in, we really, really started to, stay at the top. I would say within the top 3 to 4. Occasionally we sink down to maybe 5th place, but we really stayed in that top 3 to 4. And that felt great. I mean, it wasn't about the competition, but then again, it felt great to be, leading the group. And, this time there were more and more teams who were around 200 and, get past 200. And, it was just exciting at that point, because that was something that I never dreamed of. I didn't go into it with, expecting to be toward the top of the leaderboard, but it really felt good. It was a lot of fun. And, we had a great time as a team with all the encouragement and the messages back and forth within that little social setting. It's a certain app that we used. So, I'd say about 30 to 40 days in, our team reached number 1, and we stayed there. We stayed in first place for a long time. And that was that blew my mind. I was so amazed. I was so encouraged and excited. And it was just an experience that, I didn't expect it to happen like that, but we were just very, very much sharing tips and strategies. It doesn't mean that I personally was number 1, because I was not, but I led this team and fostered this community that just everyone was encouraging each other. And I learned so much from being a part of that health promotion, that whole experience. There was someone there who, there were a lot of people who were regular joggers and just regular walkers, and they walked to and from work. They did so much throughout their day. They just had really impressive routines. And I'm a remote worker, so I walk in the morning, and then, I don't commute to any office. So there's no walking involved in my commute and my work routine. I'm confined to a very small space when I'm working in my office. So I have to put that into my routine to get my steps in every day. And I was really conscious of that all the time. So whereas something I did on my own, I learned so much from what other people were doing that I could incorporate into my routine to improve it. And so it took my own, accomplishments to another level. So one of the things that came from all of this is, not only was I trying to lead and encourage and being the public health professional and, I want to be an example to someone else, and that's all great. But in the process of me trying to encourage and help other people, I received so much from this. I received so much encouragement. I received so much in the way of what I could do to improve myself, that it became such a win-win situation. So, of course, I've mentioned this, different settings. I'm just telling the whole story here at one time so that everybody can hear it together. So if you've heard different pieces of it before, sorry for hearing it again, but it's just the whole story. So the APHA contacted me, I can't remember exactly when, but maybe somewhere about halfway into the challenge, and they wanted to feature our team in a write-up. And that was exciting. They asked some questions and just basically, how do we keep each other, how do we stay encouraged? How do we stay on track? How do we, continue on? And I guess, it's easy to start out doing something and, you get sick or life happens, something throws you off, and then you never quite get back to it. So they're asking questions about that. And they featured our team and another team in a newsletter where we were basically presented in a way, it wasn't about our position on the leaderboard, and it wasn't about anything that had to do with lifting us up, other than the fact that we were just actively involved. And they just referred to us as, 2 teams who were very actively involved, and they wanted to know what kept us going and share, how we were performing, what kept us motivated so that it would encourage other people to also take the challenge and to do the challenge and to be involved. So that was really nice. It was, I like that it was put that way. I think, that was a great way to present, the team without trying to emphasize or focus on positions on the leaderboard, because it's not a competition in that way. It was done in fun. So, that was great. And, to be featured was awesome. I'll link to that newsletter in the show notes in case you guys are interested in reading that. I'll link to it in the show notes for this episode. And so we got that completed, the challenge. We finished last week. We just spurred to the finish with lots of positive messages. So yesterday was the official last day. Well, April the 8th was the official last day of the challenge. And the final number, the final stance is our team finished in number 6. So we were number 6 out of 392 teams. And those are the final stats for that. And there was just a flurry of activity through social media regarding that. We were, tagged by APHA on a Twitter post, and I posted on LinkedIn. And it's just been exciting to share that. I keep referring to the numbers and the place on the leaderboard because that feels good. That's personally, it's, you're proud when you can do that. But, honestly, it doesn't matter where we ended up on the leaderboard. Just the fact that we went through the process, we went through the experience as a team, and we grew. And it was so much more than I expected going in. It was, like I said, it was a win-win all the way around. It's celebrating the completion of something that we started. So 98 days altogether. Where we started, and we each had our own challenges along the way. I remember getting sick and had a few days where I could not, do any steps, and receiving encouragement from my teammates, and we encouraged each other just throughout the time. And that was, like I said, tremendous experience. So all of that has been so rewarding, so refreshing. It was way more than I expected. And I was so busy trying to help be that example for someone else. And that was really my focus, that, I wasn't thinking about all I would receive in return. And I guess that old quote is really true. You help enough people get what they want, you ultimately get what you want. You don't have to focus on what your needs are. So that was wonderful for me, wonderful for the team. And it does not stop there by any means. So one thing I want to do is let you know that the challenge ended on April 8th, but that doesn't end the drive and the camaraderie and the desire to continue to improve health, to promote positive health actions, to keep walking, to improve my health, and to keep encouraging other people to do the same. So that doesn't end. That continues on. I just put it this way. I really encourage everyone listening to think of some health promotion activity that you can take part in, that, not only will it help you, but you can help someone else. And it doesn't matter if you're in your very first class of your very first term of working on your master's degree in public health, or if you graduated 10 years ago and you're already in your senior level position in your organization and you're sitting well. Everybody can take a stand. Everybody can take action in this way and really benefit, as well as be a benefit to someone else. So it's an experience that, it's, like I said, it's something about being outgoing and being public and being, being a light and being seen. It's not in a boasting way, but just to, part of it is accountability. If you say, I'm going to do X, Y, Z, and you post it somewhere, or you tell somebody, or you dedicate, or you commit to a team, then there's some accountability there. And sometimes we need that to encourage us to stay committed and to get through see the task through. And sometimes people will just kind of watch and see what happens. And then they're encouraged and excited by the outcome. And then, the next time that something's offered or the opportunity comes around, they're ready to jump in. I saw a lot of that. A lot of people who heard me talk about it from the very beginning and didn't get involved for whatever reason, just kind of like, either blew it off or just didn't want to, or, just didn't think anything of it. And then after all that has come of it, they got excited and decided they really want to take action. And that's perfectly fine too. So, embrace those who are on board with you right away, and then just leave the door open for those who come a little bit later along. But, I think it's really you can find something that will align with your passion for public health, your area of interest, and then become that living, that active example, that living example, that walking example that people can look to and encourage others and be encouraged. I've received so many positive comments here lately, that I have inspired someone through what I've done or how I'm presenting myself. And it's not that you have to like being in the spotlight. It's not about that. It's just a role of a leader just says that you were willing to be seen and you're willing to take those steps and to be out in the front. And it doesn't mean that you're held to a level of perfection. I stopped worrying about that a long time ago. But it just means that you're just willing. Someone has to start, someone has to take the lead. Someone has to say, okay, let's do this. And it doesn't mean that everybody is a leader. Sometimes it's someone who says, okay, let's do this. And you're the one that chimes in and says, okay, I'm in with you. It's just really about taking action. So if you are interested in any way in walking for health, in being a part of some similar related type of health promotion, there's two things that you can do. I am starting there's a Facebook group that is formed from the page. So it's basically, if you go to Facebook, if you're already on Facebook, you can look up Walking for My Health. That's the name of the group, and just request to join. And you can join in the group with me, and we're going to just let that group, everyone who's interested can join that group, let it grow. We'll share ideas, tips, and information related to walking, improving health, and pretty soon start a new type of a challenge or promotion of some sort. So if you're interested in, if you were part of the group with me, a part of the team with me, and you want to continue and you're on Facebook, then you can join the team or that Facebook group called Walking for My Health. Okay. And if you were already on the team with me and you're using the app that we used, just stay connected and stay active there, because the next health promotion will use the same app. I love that app because it will allow you to sync with any type of fitness tracker, regardless of what brand you use. So that was really helpful. So stay connected with me there. I'm not going away. I'm still going to be using that. And another thing that you can do is, you guys remember me talking about the workshops. Last episode, I talked about that. I've put it in different places. There's been a buzz, conversation about the workshops. The workshops that are on my website are designed to help you get gain a skill, learn how to do tasks, to get up and running in some area, in some related to that specific topic right away. It's, there's a lot of information packed into about an hour. Some have run a little bit over, so I've been saying somewhere between 60 to 90 minutes. No, so far nothing has gone close to 90. It's been more like 60 to 70 minutes. But it just depends on how many questions are asked during the session. They're recorded, and then if you don't attend live, you're able to attend and watch the replay, which is on demand. So the workshop, you can attend a live workshop or on-demand workshop. Regardless, they're very affordable. It's basically covering the costs of time and the equipment or the technology. And you are able to grasp a task. So if the health promotion idea, if you're interested in just joining, participating, being involved for your own personal benefit, the group is a great place to be. If you want to learn how to do something like this, how to start one in your community, how to get involved in some way, you have 2 workshops right now that are on demand. They were recorded last week. And both of those workshops will teach you the tools, what you need to do to get started in a health promotion campaign. So one of them is focused on faith-based community health promotion. And that is very insightful, a lot of good resources, and it gives you what you need to get started on a health intervention that you can facilitate, create that community, that faith-based partner, and use the faith-based community as a setting for health promotion. So if you're interested in that, that workshop would definitely be something to attend, grab the resources, take notes, get the information so that you can take some action in your community. Find a faith-based partner. If you already have one, it'll teach you how to get started on a health promotion campaign that you can implement there. The other workshop will teach you how to do a health promotion or lead a health promotion campaign using online tools and technology, very much like what I just described. So that workshop is available as well. And you can, if you would like to attend both, merge that information together. But if you want either one will prepare you to be able to take action and move on it. You don't have to already have your degree completed before you do something like this. You can do this as a student. You can do this if you've already completed your degree. But at any rate, it gives you the ability to get started on leading a campaign or getting involved in a campaign right in your community. And there are an abundant amount. I mean, I can't even begin to list what you would benefit from it. And the ways, the obvious ways, of course, is it gives you hands-on experience that will help you in terms of career progression. And it also gives you the opportunity to put into action what you care about, because public health is about improving the health outcomes for people within populations in our community. So it gives you the chance to get involved and make that impact. So those 2 workshops are available on demand at DrCHHuntley.com/workshops. So when you go to my website, just go to the workshops tab and you scroll down to the on-demand section and you'll see both of those. So next steps, of course, you can join the Facebook, like I mentioned. We'll stay connected. Also in the Facebook group, it's Walking for My Health, and that is primarily what we'll be discussing in just being its encouragement. And really, it's something I do all the time anyway. I'm just continuing to be a visible example of it. I'm sharing that information. I'm expressing that, and I really like how it felt to be connected with people in leading the team. So by the STEPS challenge already ending, I had already planned to do this, or I knew that I would want to continue something once the 1 billion steps challenge ended. So this is a natural next step for me. So this is something that I'm just opening the doors for anyone who's interested to to connect with me. But then we'll also expand topics that complement, Walking for My Health. Like we'll add in topics about nutrition and how it relates to. Of course, you got to fuel your body properly to be able to walk and be healthy, and then to improve health as well. So just very top line type of information, a good community to connect with, to be encouraged and reinforce those habits and just kind of share ideas. It's not gathering together in a group for me to lecture to. It's really for us as a community to be together and to help each other as a community of public health professionals with very common interests and cares. And so that's there. And then, of course, in addition to the on-demand workshop that I mentioned, we also have coming up live this week, if you're listening to the podcast like as it's being released, this week's workshops live will include 2 that are very popular. They were popular on the survey that was initiated before I started this. So I gave everyone an opportunity to vote on topics. And 2 of the most popular were volunteering, learning how to volunteer to gain experience in public health. And then the other was professional networking. Professional networking for public health. I don't know why I can get those words out. So those are the two really popular topics for the workshops that were voted on. And this week we will have both of those live. So you have the opportunity to join me live for the networking for public health, and that's going to include, conferences and social media. Get some real clarity on, sort of the do's and don'ts and why it's important and how to kind of, how you interact on different platforms as far as social media goes, and some of the do's and don'ts and some of the things you should make sure you're taking full advantage of when it comes down to a conference setting. So we'll talk about that, as well as I'll kind of peel back and tell you a few more personal examples of things that have happened, positive things that have happened to me in terms of building a network and interacting within my professional network, and those opportunities that emerge very naturally, and the approach, and just sort of, and some people, tell me that they just don't know how to start with networking. They don't know, if they're doing it right or if it's really effective. So we'll talk about a lot of that in that setting. I can give you some examples for myself as I try to build my network, and then I'll give you some examples from people that approach me, and some of the ways that are more effective and some ways that are maybe less effective. So we go into that, and of course you have the opportunity to ask questions at the end, and then volunteering. If you just don't know how to get started, you really want to volunteer. Everybody keeps saying you should volunteer, but Dr. Elam Evans from previous episode, and I'm terrible about having episode numbers, just about 2 episodes ago. She works for CDC epidemiologist, and I think it was episode 32. And she talked about very important how the importance of volunteering and what it could lead to. And we've had several people on the show, guests on the show, that have talked about the importance of volunteering. And many of you will say, well, I don't know where to get started. I don't know how to make these connections. So we're going to talk about that. I'm going to show you some resources and talk to you about how to approach people in those areas and how to create those opportunities to volunteer and begin to get some experience as well. So both of those workshops are available live this week. And if you're not able to connect live, then they will be available on demand just a few days later. So go again to DrCHHuntley.com/workshop, and you'll be able to, or workshops with an S, and you'll be able to find the times and the information for registering if you're interested in attending live, as well as the ones on demand. Okay, I think I have actually covered everything on my notes today. Thank you guys for tuning in. I really appreciate you. I share these stories and this experience with you really because I think it's important for you to hear, and there's a lot to be learned. I learned so much, and sharing my experience with you gives you an opportunity to learn from my experience, the good and the bad. And then also I think that it also helps to encourage you to, maybe the next time an opportunity rolls around, to take advantage and jump in and get involved. And then also with the workshops that are being offered, it gives you the ability to learn what you need to learn to really take action and jump in on your own, your own journey, find your own promotion to lead and really get involved. And if you do that, I really want you to reach back and get in touch with me and let me know what you learned, if it sparks an idea, what you're planning to do, what your ideas are. Because if you get involved if something results from you hearing my story and it sparks you and encourages you to get involved in something, I'd really like to know about it. I'd like to be able to encourage you as well. So you guys, I think this is a wrap for today. Thank you so much. I say that over and over again, but I don't think I can say it enough. I really do appreciate all of you. As much as I share with you and try to help you, you guys are such a blessing to me as well. So I really do appreciate you all. Until the next time, you guys have a fantastic rest of your day.
Thank you for listening to the Public Health Epidemiology Careers Podcast at DrCHHuntley.com.